All right. Hello, everyone. Thank you for being here. I'm excited to be introducing our What Can You Do with Your Health Science Degree career panel this year. My name is Lizzie Aroni. I'm the president of the Health Science Club. Before we hear from our panelists, I just have a few announcements and reminders. The Health Science Club meets every other Thursday at 4:30 p.m. in the Arts and Science Building, room 102. We have 2 more meetings this semester, November 15th and December 6th. We'd love to have you join us there. Our club is open to all students interested in the health science field, no matter your concentration or career goals. There are many professors offering extra credit today, so if you haven't already signed in on those sheets, they're at the front of the theater on the table. And also, if you did not swipe your Stockton ID card for Osprey Advantage credit, please do that before you leave as well. At the conclusion of this event, we'll also be serving pizza, which is an awesome draw. So that'll be around the side of the theater after the event. Finally, I'd like to highlight some key players in the organization of this event. First, I'd like to thank my Health Science Club Executive Board for their support and hard work in bringing this event to fruition. If you all could stand to be recognized. I don't think everyone's in here, but. Next, I'd like to thank the members of the Health Science Club for helping us table to promote the event and for being here today. Thank you all. Thank you to the Office of Student Development and the Office of Event Services and all of the folks who help behind the scenes to help us put this event together. Thank you to Production Services for recording our event today for all the future BSHS students to come. And finally, I'd like to thank Dr. Luis Garcia, Health Science Club Advisor, and Pat Donahue from the Career Center for meeting with me since September about this event, responding to all my emails, and for all they did to help us gather this awesome panel of health professionals you see on this stage. And lastly, I'd like to thank our panelists for graciously donating their time to pass on their knowledge to future health professionals. And without further ado, let's introduce the panelists. If you all could just go down the line and say who you are, what you do, and how you found your career path.
Okay. My name is Luis Garcia. I have a lot of relevant titles. So I'm a professor in the Health Science Club. I'm also the coordinator of the Health Science I am the advisor of the Health Science Club. I'm a professor in the Health Science program. I'm the coordinator of the Health Science program, and my training is as a health psychologist. So I'm a clinical psychologist that specializes in health issues. Mostly my work has been with HIV/AIDS, but I have treated people with other conditions. And about my career path, I actually started as a chemical engineering student, and on my 3rd year, I realized that it wasn't for me, that I love science, but I didn't want to work with machines. I wanted to work with people, and I quit. In the following year, I transferred to the University of Wisconsin in Milwaukee and finished a bachelor in psychology. I was always interested in psychology, and when the first career didn't work out, I gave it a try, and I enjoyed it a lot, and end up here. Something about psychology is that there's not much you can do with a bachelor, so you have to commit to grad school. Is the main way in which you can practice.
Hi, my name is Dr. David Calabro. I'm a chiropractor. I'm a certified pediatric chiropractor, a life coach, a clinical nutritionist, also known as functional medicine. I got into this field accidentally. I was actually going pre-med. I'm an alumni here. I graduated in 1996. I got a degree in BS in biology. I was walking down the hall one day, my last year of school here, and there was a career fair. Saw spine on the table. It interested me. I went, talked to the people, happened to be representatives from a chiropractic college. Got me interested in the profession, the whole concept of helping people with your hands and transforming or changing their life just intrigued me. Went to do an internship, learn more about the profession, and from there it was just a cascade of events of healing naturally.
Hi, my name's Kylene Reardon. I'm an occupational therapist. I work for Jefferson Healthcare Center. It's a subacute rehab in Sewell, New Jersey. I got started in OT. In high school, I had a good friend that was in a really bad car accident, and she required months of rehab at DuPont, and I got to go see some of her therapy sessions. And I was really drawn to OT. I got to witness the physical therapy and the occupational therapy, but I really found OT to be really individualized and fun. And so I started off, after I graduated from high school, I went to Eastern University, and I was in their pre-occupational therapy track. And then after that, I went to Rowan and graduated there with a bachelor's in health and exercise science. I had a specialization in health promotion and fitness management. But again, there wasn't a whole lot that I could do with the undergrad in health promotion, so I definitely knew I wanted to go back to grad school, and I went to Philadelphia University and completed the master's program there for OT.
Hi, I'm Dr. Sandra Torquato. I'm a physical therapist by trade. I am also a visiting professor here at Stockton this year. My course is very similar. In general, I believe mostly individuals going into rehab have some level of personal experience or insight to the process involved in healing. So very similar scenario. I was a little bit younger at the age of 12. My cousin and best friend was involved with a cerebral hemorrhage, spent 3 months in a coma, and when he woke up, as a typical teenage boy, he was a little bit stubborn and would not do his physical therapy unless I was in the hospital with him. With that route, I got out of school. For a couple of months, they allowed me to be homeschooled, and I was able to be by his side for the physical therapy component that ultimately led him to getting home at this point. So I've been interested in neurology from the beginning, the components of traumatic brain injury, neuro recovery. I've worked in a hospital setting for the last 15 years, and that's really what led me to here. At this point, I'm in a visiting professor role because I like to share that information and kind of enjoy and elaborate a little bit on the passion that falls behind the rehab role, whether it be PT or OT, and my communications disorders. So that's me.
Hi, I'm Nicole Goodson. I'm a speech-language pathologist. I started out at Ocean County College with the idea of becoming a business major or marketing or something like that. So I graduated OCC with a 2-year degree with a concentration in business. Started at Stockton, took one speech course, speech science with Dr. Berry, and I was sold. It was so intriguing and interesting, and I realized I really wanted to help people. And business was interesting, but it wasn't exactly what I was looking for. So I got my undergrad from Stockton and went on to Nova Southeastern University for my master's. And I basically really just wanted to be part of someone's life. I saw my grandparents and a couple other people in my life suffer from various dementia and other things that affected communication when I was younger, and I didn't really totally understand it, but as I learned the degree of speech therapy, speech pathology, I realized, how I could help people. And I currently work at Seashore Gardens Living Center, which is kind of across the street on Jimmy Leeds Road. I always have grad students from Stockton come and get their clinical experience with me, and I absolutely love it. So I love the teaching component. I've been a speech therapist for about 15 years now. So I'm currently the director of rehab of the entire department, which is really cool. I've learned so much through the years, and that's basically it.
Hi, I'm Kristin D. I'm a student in Stockton's accelerated program, Stockton's nursing accelerated program. And I ended up in this way because growing up, I always kind of wanted to do patient care, but I wasn't really sure which aspect of patient care I wanted to go in. As you can tell from all the people in the panel, there's a lot of different ways in which you can experience patient care in the medical profession. So I kind of just settled into nursing because it gave me a lot of more options because I wasn't really sure yet. But, you know, with nursing, I felt like you could take it in many different ways. Not to say that you can in the other ways, but through here, yeah.
I'm Matt Cirillo, and I'm also a accelerated nursing student. And I graduated from Stockton in 2015 with a health science. And I didn't know what I wanted to do with it. I just know I wanted to work and care for people, patients. So I was an emergency room technician at the time. And I saw different professions and how they interact with people. And I saw some compassionate nurses that inspired me to go into the field. So I saw that the accelerated nursing program was new at the time. So I put my application in, I got my acceptance soon after, and here I am. And I love the care I do with the patients at Clinical.
Good afternoon. My name's Larry Newman. I'm a doctor of podiatric medicine. I was in private practice for about 25 years, and now I am the assistant dean and medical director at the Temple University School of Podiatric Medicine. And I went to Rutgers University in New Brunswick, and I was a bio-sci major. And I was planning on going to medical school. And between my junior and senior year, I got a job that summer in a basketball camp, and I met a guy that was working there who was going to podiatric medical school. I had no idea what podiatric medicine was, and I think a lot of people still don't know what we do. But he told me what the profession was about, and he said one magic word to me. I used to play ball in school, and I don't look like I was an athlete, but I was at one time. I'm old. And he said that you can do a whole bunch of things, which I'll get into later, but one of the things he said to me was that you can do sports medicine. And I said, I can't believe that. I could go into sports medicine and be a doctor at the same time. So I ended up looking into the profession and went. And like I said, I was in private practice for about 25 years in Pittsburgh, Pennsylvania. And I actually became the Pittsburgh Steelers and Pittsburgh Pirates foot doctor at one time. And I got offered the job at Temple about 20 years ago, and decided, since I do enjoy teaching as well, and I'm an administrator as well, and I still see patients and I teach, it was really exciting for me to do that. So I'm still going at age 70.
Great, thank you all. Yeah. Now, if you could all address the following questions. What is one of your favorite aspects of your job? And what is one piece of advice you would give to a prospective student in your field of study? Dr. Garcia.
Okay. I think one of the things that I enjoy the most practicing is when, after working with a patient, you see the improvement. So seeing people doing better, I found it very rewarding. Sometimes they're very strict, probably for psychology, more strict than other professions. Contact with your patients after you no longer treating them, but sometimes I wonder how my patients are doing. You know, you connect with some of them and care deeply about how they're doing, and then wonder, you know, how are they doing. But I love seeing the progress in the patients and seeing them doing well. Did I address the...
The second question was one piece of advice you would give to a prospective student.
Yes. There's a lot of advice at all levels. I would say once you are applying to grad school, if you meet the requirements, you will be as good as everybody else that is applying, and at that point, the best that you can do to increase the chances of being selected is bring something different. I tell my students to research where they want to apply and contact faculty there. they're doing something that they like. Because, when you're choosing among 80 people, if you recognize a name, if you make a personal contact with somebody that is making those decisions, that can make a difference. If you are as good as everybody else, what can make the difference is that you made a personal connection with somebody.
Everything he said, and then I think the fact of going to practice every day and working with a variety of different people and health issues is, it's still a marvel to me and amazing every day that someone can come in with X, Y, and Z and leave that day without it. Number one, to see just a change immediately from someone struggling with something to someone just not. And you get to see, again, a variety of different people. You get to work with your hands, and you get to see changes in people. And where else can you work with your hands, work on somebody, and see the body just heal on its own? That's cool. It's a cool thing. One of the things I would ask, would encourage you, I think I'm gonna answer it generally. Do what you love. Don't make your decisions based on fear. Don't put yourself in a box of what you think people, whether it be family or friends, what they think you should be doing. Follow your passion, follow what interests you, follow what you're gonna love doing every day, because you're gonna spend the rest of your life hopefully doing something, and you want to love doing that. To go somewhere every day and feel like you're in prison and not love it is just gonna be torture. So I think really just pick something you love. That question of if you could wake up tomorrow, or if you had a genie's lamp and can create your ideal career path, what would that be? Have clarity in what you want to do, love what you do, follow that, work hard, no matter what. Jump over the hurdles, go through the roadblocks, don't face the mountain and turn left, go over the mountain, because it's on the other side of hard work, determination, confidence, perseverance, etc., is where you'll find happiness and success.
You're here.
I'm going to kind of piggyback off of that a little bit as well. Definitely find something you're passionate about, because that passion is going to show through your work. If you're going to have to do it every day, make sure you enjoy doing it. One of the favorite things that I love about OT and my career as an OT is the individuality of all of my treatment sessions. I think it's really fun to get to go in and assess somebody, find out what's wrong with them, like what their individual deficits are, and find creative and different new ways to help make them better. I can go in and clinically look at someone and find out what their individual goals are. Like a child's goal might be that they want to be able to go out onto the playground and play with their friends, versus an older adult who might still want to be able to drive to the supermarket and do their own groceries. So I can really make customized plans and treatment sessions to address a variety of needs. A lot of people don't really know what OT is. I get asked all the time, like, oh, so you help people find jobs? I was like, no. I think there's a big misconception in the medical field as a whole about what we do. But we really have a great value in a lot of different practice areas. We work in hospitals, we work in outpatients, we work in mental health clinics, in schools. There's just so much that you can do with it based on what your passions are, and you don't have to just stick with one thing. I have a lot of staff that I work with that split their time between working in the clinic versus working in a school. My future goals are to start teaching. So kind of leading into that, one of my pieces of advice would be definitely go, when you're doing your clinical observation hours, go to a variety of settings. I get a lot of students that come to me for their field work, and they're like, I didn't know you toileted people so much. So really understanding what the job entails so that you know if it's going to be right for you or not. And if you ever plan on teaching, go right for the doctorate out of school, because it's so hard to go back after you've been out for a while.
So yeah, all of that, and we follow up from there. I'll have to go back a little bit. I didn't include, I am a Stockton grad through and through. I've seen the college grow. I've seen the numerous programs grow while they're here. And my piece of advice would be to diversify. I think everyone's coming into a career path or a career choice with individual interests and individual qualities of things they enjoy. And when there's something that you truly enjoy, you can always apply it to your career path. I know as far as physical therapy, my interest is neuro. However, I have numerous colleagues that are working within their passion, whether it be equestrian type of therapy, if you like animals, veterinary medicine. I have a friend that works strictly with musicians and dancers in the arts system in New York City. So bringing in your diversity of interests and making that known as you apply to your interest schools is super important to set yourself off and differently. As Dr. Garcia mentions, contacting the school to kind of set a name for yourself, but then also give yourself something that'll stand out. My favorite part of the job, if I could sum it up into one, is because I do work in the critical care setting, spinal cord injuries, strokes, my favorite part is the hope that you're providing those families in those moments that they're just not sure what the future will hold. But in the clinic, being able to guide them, advise them, provide them that hope that, at some point things will improve through a process of rehabilitation is the best smile I could ever see on my patients and their families' faces. So.
Nice. Okay, wow, that's a lot. So as I'm listening to all of this awesome perspective, the one thing that is ringing in my mind, my favorite part of my job is the interdisciplinary approach. Because when you have a patient, it's not just you who's getting that person better, it's a whole team of people. And if you can work well within that team and speak effectively and work together, you see the growth of the patient as a team, and you feel so happy and like you're part of something so much bigger, And my one piece of advice would be to always remember in your heart what you chose for your profession. So whether it's speech, OT, PT, you're going to go for your degree, you're going to go through clinics and all these things and get jobs and have all these experiences, but always hold it in your heart that you chose your degree to help people. And if you can keep that on the forefront of your mind, like always, even in the hardest times, you'll be a great whatever you choose to be.
So to build off of that interdisciplinary team thing, my favorite part of what I, in the future in the nursing profession would be sort of getting your patient, getting your assignment, and then putting all the pieces together and then watching that person work through healthcare as a member of that team. Just before this panel, we were both in clinical, and I saw a patient that I had in the community who I seen 3 weeks ago. And we just measured her wounds and just changed her dressing and everything like that. And the wound went from 4 centimeters wide to 2.9 centimeters, which doesn't seem like a lot, but it's improvement. And considering the setbacks this person has and, sort of the effects of the community and all that stuff, that's the most interesting part, seeing this person and all the pieces kind of come together and then watching this person, who came in through your door, metaphorical door, of healthcare and leave the door healthier than where they were. My piece of advice for you guys would be to never stop asking questions. And that sounds really cliche, but hopefully you're all here because you're asking the question to yourself, what can I do with my degree, or something to that matter. But it's not just that. In the healthcare setting, it's not just you. You're part of a team. Always understand why other members of the team are doing something. Always understand why you are doing something for your patient. Because if you don't understand and you're just going through the paces, you're saying, oh, here's this medication, here's that, you're doing more of a disservice to yourself and not learning and understanding. So always ask questions and keep learning.
My one advice is you can look up online what you want to do, all you want, but until you actually get to the field and see what's going on, you might not know exactly how the profession goes or how it is. So I wasn't really too sure about nursing. Everyone's heard of nursing, but seeing it in action is a whole new thing than just looking up online. Same thing with physicians, chiropractic. I have had over 100 hours before I applied to the nursing program, shadowing different kinds of professions before I applied. So it's completely different than just trying to look it up online. Try to shadow someone, just try to get out there. Try to show your interest too. And what I love about nursing is there's such a variety. You can go to anything, surgery, ER, trauma, you name it, it's out there. My personal favorite is travel nursing. So like 1 month you can go work in California in an ER. The next month you can go to Alaska and work in a med-surg unit and so on. I just love the profession and I hope others find it too.
That was a great answer. They all were great answers. So I'm going to give you some advice that I think goes in a little different direction as well. For those people who really want to get into medicine, you have to do well on your MCATs if you're going to take them, and you need to have a good science GPA. Having said that, the other advice I have is basically what everybody else said here. You really need to love what you do. I do not feel like I've ever worked a day in my life. I love going to work still every single day. You have to have the passion, and you want to be able to help people. And it sounds corny, but if you don't want to help people and you don't have that empathy, don't be in this field, in any field of medicine or these fields here. Having said that, I do think that one of the things in my profession is we develop a very, very great rapport individually with our patients. Our patients have a love for us, and I have still had patients from 20, 25 years ago that send me birthday cards and contact me. I've even had patients come all the way from Pittsburgh to see me, to have me still treat them in Philadelphia. So you've got to really be able to want to help people. I think that's a key.
Awesome. Great advice by all. And just as a kind of a plug, after the event around the pizza, you can ask individualized questions too. But for our final question before the Q&A segment, could you each tell us about one interesting story or case from your position?
Yes, I have several. One very hard case that was very interesting. I bet most of you have heard about multiple personalities, and psychology or psychiatry that falls in a family of disorders called dissociative disorder. I don't know, everybody experienced dissociation. Like if you have ever been in the classroom and suddenly you realize that you have been staring at nothing for a couple minutes, that is dissociation. But there are patients that dissociate to detach from reality because reality is too difficult for them because of trauma. And I had a very hard case, a woman that had experienced a lot of sexual abuse, and she would dissociate all the time. And so imagine trying to talk about the trauma without pushing her to check out. So it was a very challenging case. And as a professional, sometimes we enjoy really difficult cases because they challenge our skills. And I had to walk a fine line all the time, helping her to recover from the trauma, but not pushing so hard that she would check out, and then, it will take her a couple of minutes to come back and react. She would just stare at the wall and be unresponsive. I'm gonna say one more thing. I also, because some of the panelists have mentioned in a professional collaboration, more recently I work with, and this is more a health psychology case, with a 12-year-old boy that was depressed. And so he had a congenital spine disorder, and he was in a lot of pain. And when people are chronically in pain, they get depressed. So I help him with the feelings, but most of the work that I did was to alert the professionals around him. I talked to the social worker that managed the case, and we contacted the school for him to have a chair that was better for his back, so he didn't experience as much pain. I helped the parents to connect with CHOPS in Philadelphia, and a pediatric surgeon evaluated him. Eventually, he had surgery. But what I could do was limited because I cannot take the pain away. So the best treatment that I could provide to that child was to work with the rest of the professionals around him so he could get the care that he needed.
2 weeks ago, a young girl, well, yeah, early 30s, came in 37 weeks pregnant, transverse breech, present transverse lie baby, which is sideways, and had history for years of migraine headaches, sinus problems. She was in a car accident. Her legs were crushed during the accident. She had a surgery on her right leg, screws inserted in her foot and her left foot, and was walking on her left foot on the side of it for years. And so her reason for coming in was because I deal with pregnant women and infants and children as part of practice, and we do something called an in utero constraint technique, where if a baby's breech or transverse or not in a normal position, there's techniques we could do to allow the body to naturally, the baby will turn, so someone could give a natural delivery, vaginal delivery, not have to get a C-section if that's the case they want to go. So she went under maybe 6 to 8 adjustments in the last couple weeks. And this morning she told me she sent me a message, said my water broke. So she went into labor. She's now in labor probably. And when they went into, well, not when they did an ultrasound, her baby was ready, face down, ready to be delivered. So she avoided a C-section delivery because she has 3 other kids and she wanted to keep going natural. As another side effect, her headaches were gone totally after her second adjustment. She was now walking normal on her left foot and walking normally. Her pain in her neck and her lower back were completely gone. Her sinuses just resolved and just went away. She said I was able to walk outside and smell the grass being cut next door, which number 1, I had trouble doing, but 2, usually that would trigger my allergies and I didn't have any allergy symptoms. So, and that's what's possible. Not all cases are that radical or that fast to get well, but this was just an example. And I'm going to break the rules and tell you another one real quick. 7-year-old comes in with headaches and anxiety, horrible anxiety, that she can't go to school, has trouble doing anything without crying or feeling fear. And why would a 7-year-old be experiencing these kinds of symptoms? I think she's had headaches and migraines since, I think they were diagnosed at 4 years old. And within 2 weeks of care, her migraine subsided and her anxiety completely went away. And she's now just enjoying a totally different life. So.
I have 2 stories also. I think that's a testament to how much we all love our professions, that we just want to keep going and going. So one thing about myself, if anybody saw me walking in, I came in with a cervical collar on. So recently, actually 1 month ago today, I had here's your anatomy terms, your C3 to 7 disc removal and replacement with cadaver bone and a full fusion with plates and 8 screws. So I still have a lot of restrictions, and I'm currently out of work right now until I'm healed. But I think as an OT and as other clinicians, we are constantly assessing people when you go to the mall, when you go to a restaurant. I know for me, I'm always looking at people like, oh, their walker's a little too low, or oh, they really need some adaptive utensils. But for myself, I was able to use my clinical knowledge and experience to help prepare for my procedure. I knew that there were going to be some things that were challenging, like if you can't bend your head at all, how are you going to brush your hair? How are you going to put your socks on? So I was able to make some necessary adaptations to my home and get some necessary equipment in place prior to going. So I think that that's just something that really benefits myself and my family and friends. But also a client story. I recently had a gentleman 84 years old. This was his third rehab that he came to because he just had bad experiences at previous ones. So we were kind of a last-ditch effort for his family. Prior to going into the hospital, he was completely independent, was driving, living alone, went in for what they thought was a very routine cardiac procedure, but then that led to a slew of other complications that landed him with, I think, about a dozen hospital stays. He wound up staying in my rehab for his full 100 days that Medicare allows. When he first came to us, he required maximum assistance of 2 people just to get him to get out of bed, to be able to stand up. And by the time he was leaving, we had him standing up with minimum assistance of 1 person. And about 2 weeks ago, I've been able to keep in contact with his family, which I think also shows the personal relationships that we make with our patients. His family invited me to come over and visit him, and he walked out of his room with his walker to greet me. So I think it just shows what the dedication and the hard work, not only of the patients, but also the staff that care for these patients, how much progress they can make and how life-changing it is for them. Because had he not come to rehab and not completed the course, he probably would have ended up in a nursing home, or, you know, who knows what would have happened. But
So I'll follow the rules for once in my life, and I'll just kind of give one example of my clinical base, although I think thinking about which one to share has been a challenge because there are just so many amazing experiences, relationships that I've had in the 15 years of clinically being bedside. You know, I think the hardest part, while it's amazing and beautiful that at times you do develop these great relationships with patients, with families, in their strive for hope, I also caution that there runs a thin line, as Dr. Garcia mentioned, about how emotionally invested you become in every single person, because there's always going to be that person that makes a change. And ultimately, regardless of the scenario, you may or may not be able to make a long-term impact. However, my case that I'm going to be sharing today happened about 3 years into my clinical experience. I was still wet behind the ears and really felt that we're going to confront everything. I could still make everything better. I had a patient who, you know, on a spring day decided to go out on his motorcycle with a spouse on the back and was inevitably in a car accident. The spouse was deceased at the scene. My patient had a complexity of injuries, multiple injuries. This was not local, so for privacy reasons, multiple injuries that ultimately led to a transfemoral, so high leg amputation, in addition to about 3 weeks on a ventilator and a traumatic brain injury, with diffuse other injuries, you know, lungs, blood in the lungs, chest tubes, those, and numerous surgeries. That patient, upon wakening, had no recall of a spouse, had limited memories or cognition awareness of his family, and on a day-to-day basis had to be told that his spouse had been deceased. That patient became very, very depressed. So it was a thin line as a clinician, being able to pull in that interdisciplinary approach, making sure I was going in with my occupational therapist. At the same time, my nurse was able to distribute the medications he required, to kind of give him some hope that he had to sit up, that his family was still cheering for him, and that ultimately, you know, we would get through this together. That patient did spend about 3 months in a hospital, which is very unusual, prior to going to rehab. So that was about 3 years into my career. In that time frame, you know, you learn about the patient, where you're from, where you do your grocery shopping. He learned what my hometown was. 3 years after that, darned if he didn't find me, because he knew where I liked to get my lunch meat every week. So apparently he had decided amongst himself to come and find me. And he knew that I liked my lunch meat from this specific store. And he had started to ask around for me. He initiated the conversation, he initiated the contact, that he wanted to find the person, that one smile that he knew would get him through. And ultimately, he came back to tell me that had it not been for the gentle encouragement, he didn't use those nice words, the gentle encouragement that I provided him, he would not have continued on in his rehab process and would have given up. Subsequently, he has met all my children, he's met my husband, he will not let me break that contact. He's doing amazingly well. He is now, he has a prosthetic, he has remarried, he has a family, but, you know, it's a thin line on knowing when to push, when not to push, and how emotionally connected you get. I had forgotten about that scenario until he sought me out a few years later, but it kind of always sits in my head that we don't know the change we make on a day-to-day basis, but sometimes to be reminded of it kind of keeps you going through all the logistics. And in your case, think about those volunteer hours you've had and remember them when you're getting to finals and having a hard time with that coursework, because it'll all be worth it in the end.
So I'm sitting here thinking about a patient that I had. I just graduated with my master's and I was in my clinical fellowship year. And I was in a nursing home. And you think, you know, you're 20-something years old in a nursing home. People in nursing homes are old. They're, you know, grandparents' age. Well, they're not. And I learned quickly that I had a patient come in and he was my age. He had been Christmas shopping, and he got jumped in a parking lot, Walmart parking lot. I don't know how many guys, maybe 4 or 5 guys, beat him up, stole his money, stole his packages, severe traumatic brain injury. So this young guy comes into the nursing home, and it was shocking to me that, you know, he was there. So he's in a wheelchair, his arms are kind of restrained down because he was very confused. He really couldn't talk, he couldn't walk, it was scary. It was scary for me. But I knew that I was there to help him, and over a couple days, things settled down, and I got to know him and became very, like, intrigued with all of it because I just really couldn't get over that he was my age. And I'm here helping a person that's my age learn how to talk, read, write. I mean, we did everything. And some of it started to come back spontaneously, but a lot of it, he needed a lot of help. Physical therapy helped him to learn to walk again. Occupational therapy helped with writing and activities of daily living and things like that. And he was with us for over 6 months, and one day, he walked out of there, and so this is 15 years ago, and I still get birthday cards and Christmas cards, and he's married and has a career and has kids, and it's so awesome that, you know, I saw him in that state and was able to be such a huge part with my team, with physical therapy and occupational therapy, to bring him back to just the way we are right now. So that's my story.
My story comes from clinical experience because we're still in school. We don't really have like any professional experience, but it's still sort of valuable, at least to me, I see. So it was fall semester, or spring semester rather, and we were this is our first clinical experience in the hospital, and we had learned all of the clinical experience, like the basic clinical experience in the lab, like doing an assessment like a head to toe, you know, running through all the systems, checking everything and making sure everything is okay, or seeing what's not okay, and then, you know, sort of developing a plan on how to address that patient from there on forward. So assessment, super important skill. In lab, I was okay with it. I wasn't like super great, but I wasn't also, you know, like had no idea what was going on. In the clinical, completely different story. I went into the clinical and it was 2 weeks in, or 3 weeks in, and our clinical instructor, Russian lady, really thick Russian accent, very intimidating, but really nice at the same time. And she just said, "Here, come with me, we're gonna do an assessment." And first assessment I've ever done, and I'm like, what the heck? I have no idea what I'm going to do. So I'm standing there with the patient, they're in the bed, and everything just falls out. I have no idea what I'm doing there, even though I knew it in lab. So I looked at her, she looked at me, and I'm like, okay, sure. I started like going off and, you know, head to toe, start with the head, check the hair, check the skin, check the eyes, check the reflexes. And then she saw I was struggling, so she kind of helped me out. I think that moment really taught me, like, as a student, you feel like you're required to know everything, and sort of school teaches you, you know everything, you fail a test and you don't. And that's a really humbling experience. And when you go into the medical profession or any profession, if you know everything, that would be nice. And if you know everything, you know, there's no way you can know everything. That's why there's many different professionals sitting up here telling you, I know what I know, how can we work together to make this person better? So, yeah, that was pretty much it.
I'm going to be at the opposite end, where his was in the beginning, mine was a couple weeks ago. We're at the end of our accelerated nursing schooling, where I went to home care out to a patient's house. And for those who don't know, at home care, it's you, the patient, and whatever you brought in the car. So hopefully nothing goes wrong. But we went to this patient's house and we found her on the floor. The nurse did a quick assessment and quickly went onto the phone with the decision maker of this patient. And it was just me and this patient. And everything from this point on was just either I had a nurse holding my hand or I did an assessment in the lab. But then I saw blood on her lip. First thought is she on blood thinners? Is there a brain bleed? Perla, how's her eyes doing? Assess her mental status. And my training just kicked in. It's next assessment, next assessment, next assessment. And when I was all done, I looked back at it. I'm pretty sure I hit all the bases, and it was really, luckily she was all right and everything was okay. But it was just a really cool experience that everything we learned in lab, everything up to this point was kicked in, and everything we learned works. I don't know how to put it in better words, but all this training that we did in school kicks in. It's not just labs, it's not just words. It's real, and your training will kick in.
So I have very, very many stories, obviously, for 45 years of practice, but I'm going to tell you about a story of a patient that I had the very first week I was in practice by myself. I had opened up a practice cold, and I had one patient at 9 o'clock in the morning Monday, and no patients the rest of the week. And I was ready to go home Friday afternoon around 5 o'clock, and a patient walked in off the street. He didn't have an appointment. He saw my little shingle that was outside and saw a podiatrist, and he knew it had something to do with feet. And he came in, and I did a full exam on him and a history. And as it turned out, I said to him, well, there's really not anything I can do for you. Your main problem was that you have a lot of swelling in your lower limbs, but you're in kidney failure. And so we rushed him to the hospital, got him admitted. And of course, we don't treat those kinds of things. We treat the manifestations of systemic disease, but we don't treat those type of diseases. And I got a call the next day from his physician, who we referred him to, and said to me, "You're a podiatrist?" And I said, "Yeah." He said, "I didn't know podiatrists knew anything about medicine." And I said, "Well, we go to medical school for 4 years. I had a residency. We are trained to learn everything that you learn. We just are geographic body specialists, and we're not organ specialists." He said, "Well, I want to thank you because you saved this guy's life. He would have been dead if he hadn't been admitted." And I'll never forget that as long as I live. And it taught me something, too, that, you know, we're there to help people. And I'll never forget that. This is over 40 years ago this happened.
Awesome. Thank you for those stories. Now we have time for questions from the audience. If you'd like to raise your hand, we'll have 2 e-board members walking around with microphones so you can ask your questions.
Hi, my name is Nevada. My major is health sciences, and I'm looking towards, looking to hopefully get into the accelerated program, nursing program. So, was it hard for you guys to do? Anyone of you guys? What's your name again? I'm sorry. Anybody.
Matt Christian.
Matt Christian. Okay.
Matt Christian.
When did you guys apply to the accelerated nursing program, and was it hard to do?
Oh, jeez.
Well, I applied January 1st, I emailed the director at the time, building up to it, to make sure she knew I was interested. And I wanted to show interest right off the bat. And she told me when I should apply. And from me asking all these questions, she looked out for my email, hopefully. And was it hard? Well, I think the hardest part was the GPA. The rest of it is I love shadowing. I love taking care of patients. I loved the hours I worked in the ER. So hard is, I guess, relative of what part of it, what do you think would be hard, may I ask?
I don't know, just getting accepted into the program. Maybe you said it right, the GPA part of it. Just, the requirements that you have to meet. What year would you say would be a good year? Because, I don't feel like I'm, done. I don't know what year I would, try to apply to the Accelerated program. So, when do you feel like it's a good time for me to, apply?
So I came into the Accelerated program a little different from that. I think
I waited a year.
Yeah, you waited
I
a
worked
year.
a year, then I applied.
I applied right out of, I don't know if I said, but I graduated from Stockton with health science degree, just like you guys, and then I went straight into the Accelerated program. I asked my advisor, when should I apply? He told me they have for admission or something, and then it's as soon as you meet all the requirements,
Try to do
apply.
Okay.
The sooner the better, in my opinion, and then just make sure, you fulfill all the requirements. In regards to whether it's hard or not, the word accelerated sort of may seem scary to you, but it's not really scary. It's develop a good, repertoire with your repertoire. Yeah, with your peers and everything. Work together as a group. The accelerated part sort of just means you finish the general graduation requirements. Now you just got to take the nursing courses.
There's a lot of material, but don't forget, you're in a cohort. You're with everyone. You're all in the same boat. You're all going to work together.
And the same way, I'm sorry, go ahead.
I was just say, we study together every opportunity we get. Before here, we were studying. After this, we're probably going to be studying.
I brought my study stuff with me. But, everyone is saying if you work in something you love, you're not going to work a day of your life. It's the same way when you learn. If you're learning about something you love and you're passionate about, it's not going to seem like tiresome work or a job to you. You're going to be learning it, and it's going to be like, wow, that's something new I didn't know. And then it sticks to you, and you're like, okay, then it's not really hard. Somewhere in the back.
Thank you. Another question in the back?
This can kind of go for anybody. I'm a health science major going for physical therapy, but for any of you, have you seen the profession that you're in change, and if so, how?
Well, I can answer that really easily. When I first started in my profession, a lot of people, and they still don't know what we do, did not even understand what we do, and they thought all we did was cut toenails and cut corns and calluses. And I can give you the best example of how we've changed. When I was early in my practice, I had a patient that used to come in for what we call regular foot care on a regular basis. And she walked in one day, really came in on crutches. She had a BK cast on. And I said, well, what happened to you? She says, oh, I fell and I broke my metatarsal. And I said, well, why didn't you call me? And she says, well, I didn't know you could treat that kind of stuff. I just thought you cut corns and calluses. So I explained to her that, in the future, if she ever hopefully didn't have something like that again, that I would be glad to take care of her. As it turns out, just before I was leaving my private practice, I had done a major reconstructive surgery on a patient, and she was all doing well and healing. And when I was saying my goodbyes, she said, hey, while I'm here today, could you recommend a foot doctor for me to cut my toenails? And I go, well, why can't you have me do it? And so that's how far we've come in our profession. It's amazing. And I still marvel at the fact that even today, though, people have no idea what we do.
I just want to piggyback a little bit from the PT perspective. I truly believe and feel wholeheartedly that programs like health science are really promoting awareness, the intercollaborative respectfulness that's happening out in the field, that the knowledge base, we have much more informed consumers, and my knowledge base is in the last 15 years. Our consumers are becoming much more informed. Therefore, I wholeheartedly feel that programs like our health science degrees that promote that same intercollaborative respect and information are expanding our knowledge base. So as long as, even in the field of rehabilitative services, our coverage area and our capacity to work in a broader field has grown and expanded even in the last 15 years. And I anticipate that that'll continue to be exponential growth as healthcare changes, which you're all learning about whether you want to or not. But the changes in healthcare, the uncertainty of healthcare, and that proactive business model related to healthcare will continue to promote that expansion. So from the rehab perspective with some managed care background, that's where I am anticipating that the growth of programs like health science are just, you can't help but have changes in the healthcare field. So.
And from an OT perspective, kind of going off of that, we're starting to see a lot more OT referrals where in the past we were really not known and not that well recognized in the medical field. So I think it's really important that as a profession we advocate to our fellow medical professionals to show them what we do and how our services and skills can be utilized. OT started back in World War II time. We were basically just activities and encouragers to get the soldiers up and moving after they had been injured. And now fast forward, we have such a medical knowledge base. Not all that long ago, OT was an entry-level bachelor level, and we have since moved forward to now a master's entry level, and I think that we will follow suit soon to PT it being a doctorate level. So I think education and knowledge based wise, we're really developing and advancing, and I think we'll continue to.
From the nursing's perspective, it's changed quite a lot because both Matt and I are male, and predominantly nursing in the past has been female. In addition to that, we're sort of learning about it as education in nursing goes on. Actually, not just in nursing, but in all of healthcare. We're moving from a sort of siloed healthcare experience to a more team approach. And, as she's mentioned before, at a certain point in time, not many people may have known about speech, OT, PT. It was just nurse, doctor, who do you see, what it is, and that's it, you're done. But now, a bunch of people are coming to that patient's room and they're saying, here's what you got to do for my discipline, for what's going on here and how we can help get you better. So it's really becoming more of a teamwork thing. And in the future, I hope that we sort of eliminate that sort of hierarchy of medicine where you sort of see some people at the bottom and you see the doctor at the top. Sort of more as a collaboration of people working together. Because when you have that hierarchy, it's sort of hard to treat the patient if you're afraid to ask someone something or, sort of work with your teammates. If you can't work with your teammates, it's not really helping the patient.
And then I'll speak on behalf of speech. So speech therapy, 15 years ago, you only had to have a bachelor's degree, and you're kind of stereotypical, oh, you teach people how to say R's. You'll hear that your whole life. And you want to pull your hair out because you're like, yes, that's all I do. But really, now it's a master's level, and again, we're going to hopefully follow suit with the doctorate. But what I like to say from a nursing home perspective, we're from here up. So meaning brain, cognition, ears, hearing, chewing, swallowing, breathing. We're very, very complex, and the word speech is kind of like a misnomer. It doesn't really correctly describe everything that we do. So 15 years ago, you think of more of a school therapist, where now it's hospitals, NICUs, nursing homes, home care, early intervention. There's a lot of diversity with the field.
I think in general, how the healthcare field is changing is that as we gain more knowledge, professions are becoming more specialized, and we are adding more levels of professionals. And I'll give you mental health example, but it's happening in all professions. Perhaps 100 years ago, we only had psychiatrists and psychologists, and now we have psychiatrists and psychologists and social workers and counselors and psychiatric nurses. And we specialize in many things, from, the more well-known mental health issues like depression and anxiety to feel like mine that is really recent as a health psychologist. So 100 years ago, a doctor had all the knowledge about medicine because there wasn't that much. But today, no one profession can hold all that knowledge. So, more professions have been appearing in the past century, and I think they're gonna continue to appear. I was in a conference in August, and the keynote speaker was talking about the 7 big changes that are coming to healthcare, and one of them is we will have more aides. So they will, because, for example, PT is becoming more sophisticated, so there are some tasks that it doesn't make sense to pay the rate of a PT, so PT aides will do those tasks, and the profession will go up, and that is going to happen with all of our professions.
Any other questions?
Hi, I have one for the nursing majors. I was wondering if it was hard to adapt to going to school for 15 months straight.
How we adapt to
What
go
was
into
the
school?
question again?
For the accelerated program for going to school for those 15 months straight, was that hard to get used to instead of having those breaks?
So it kind of becomes a routine. To give you my schedule is Monday class, Tuesday off, which is study, Wednesday class, Thursday clinical, Friday work, Saturday clinical, yes, Saturday clinical, Sunday off, which is study. So it becomes a routine. And was I going a little crazy at the end of the summer when we didn't really get a break? Yeah, kind of, but it just becomes natural. Just instead of going to study, I'm going to go hang out with my friends and study. And we always try to find time for ourselves. A little bit here, a little bit there, just to find our way to cool ourselves down.
Yeah, it is a little different without summer, but really that's the only thing that you don't really get. You get fall, and then you don't have anything for December, and then you have spring, and then you go into summer and you get a month. At least the way the program is where we're at now, you get August off, and then you're back again at the fall. So really, you're really only missing summer there, but it is a lot of studying, and it's a lot about taking care of yourself and knowing when you've reached your limit, saying, okay, I've studied, I need to take some time for me or else I'm going to lose it. Yeah, definitely knowing where that limit is. And working with someone, working in a group. If someone else is doing work and you're there, you're not just going to sit there and not do anything because now you feel a little bit pressured. So you kind of have to do work. And understanding and knowing yourself, I think, definitely helps with that. That's how I've adapted to that.
Just a quick note on that. I went to an accelerated master's program for OT. So we did Thursday, Friday, and Saturday classes. It was all day. We started at 8 o'clock in the morning, went straight through to about 6 o'clock at night, all 3 days. Although it's really long hours of constant work and you go year round, you don't get any of your spring breaks or Christmas breaks. But it allowed me the opportunity to work full-time all the way through grad school. I was living on my own at the time, so I had to work and afford an apartment, afford my own health insurance. So it definitely has its benefits, but you are going to use all of your free time going towards your studies. I always had my books with me when I was at work. I was working overnights, and you're constantly doing, you're being pulled in multiple directions. Doing the accelerated.
Someday you'll be happy to go back to school. You'll wish you were back in school again. This is the best time of your life, believe me.
Yeah, some of us become professors.
Any other questions?
So this one's kind of for everybody, a little bit less for the nursing students because you're still in school, but what was your deciding factor on choosing where to work, where you work now? Did you know somebody there? Was it the pay, the location, whether in hospital, out of hospital?
Well,
So I've worked in numerous different areas of specialty, but I think my first full-time official big girl job ultimately came from the clinical experience. So whatever program you go through, you will be required to have your internship, your rotations, your clinicals, whatever you call them in your program. But ultimately, as a student, you're getting the ins and outs of that facility. As an employer, you have a 6 to 12 week job interview where they're investing their time in you and their knowledge, whatever training they provide you. So I know oftentimes that clinical experience, that background of facility that you worked at as a student, often tends to be where you fall back as far as your level of comfort. And then there's so many individual decisions that go into job selection that my perspective is take advantage of the clinical situations that you'll be provided with your program.
I did my residency in a hospital in Pittsburgh. It just happened that that was a program I was in, and my wife and I fell in love with the city, and so we decided to open up cold there. So that's, a lot of people do end up gravitating towards the areas that they train in. I mean, I never dreamed in a million years I would ever even, I never had ever been to Pittsburgh before I went to my residency program. I'm from North Jersey originally. I had planned on coming back to Jersey and practice, and I ended up in Pennsylvania. So the job that I got at Temple was, sometimes, you know how you hear this thing, being at the right place at the right time, and just things are going to happen as it happens. My dad was still alive at the time, and he was not well, and he still lived in Jersey. And when I got the offer, it was a very tough thing for me to leave my practice. I had a very large practice with a lot of partners that we built up, and actually one of my partners, I just read today, he passed away today. And another of my partners won't speak to me anymore that I left the practice, but I got a great opportunity. I do, like I said before, enjoy teaching, and the opportunity came, and I knew I could be closer physically to where my dad was, so that's why I came back to Philly area. And I live not too far from here now too, so.
I had finished up my last fieldwork rotation in an outpatient department, and I loved it and thought that was where I was going to go. So I interviewed, and while I was kind of taking my boards and everything, but then later found out that they were not going to hire any new grads. So I was just fortunate enough that the hospital that both of my grandparents had been admitted to in their older years, I had gotten some contacts with them in the therapy department, so I applied, and they offered me the job, but I hadn't received my clearance or my license yet. But I was fortunate enough that I got my acceptance letter and my license on a Friday, and I was able to start working on a Monday, and I've been there ever since. So I think once you find you're in, if you enjoy it, stick with it, but if you want to branch out and try different places, don't be afraid to kind of move around a little bit and find your niche, because there's a lot you can do with it.
And I think also the beauty of PT/OT and speech is you can move around. I still see early intervention kids in the morning, and I work in a nursing home at night, or during the day. So, you're not limited to just one thing, and you're going to have a lot of opportunities for jobs because there are so many avenues you can take. For me, my entire education, pediatrics, that's all I wanted to do. My last clinical was in a nursing home, and I fell in love. I realized, I loved my grandparents growing up, and I just felt like, how lucky am I? I get to hang out with everybody's grandmom and grandpops like all day, yeah. And so it was really, and they have stories to tell, and they have these rich lives, and you're doing therapy with them, but you receive gifts from them like every day, So, but yeah, so that's why I kind of ended up there. And Seashore Gardens is very beach themed, and I live on Long Beach Island, so I feel like I'm still at the beach. Really, it is. There's like murals and everything. It's beautiful there.
I went, my first year in practice, I worked for chiropractors in a wellness center, and about almost a year, and I realized that I had an entrepreneurial side to me that needed to be expressed. And so I decided I needed to be on my own to practice in the way that I wanted to practice and how I wanted to practice, and so I went in that direction. And you know, I've been in private practice for 16 years now, but I think too, if people have students have an entrepreneurial side to them, they should explore that, because you know, we always say, where am I going to work, and trying to find a job somewhere working for somebody, where some of you sitting here might have that entrepreneurial side of you that needs to be explored. So I guess you'll figure that out as you go along.
Awesome. Does anyone have any last questions? Two more. One on the back.
This is a question for the speech therapist. How do you feel like all the new research and neuroscience has affected speech therapy, and has it made more treatments available?
Definitely. There's so many CEU courses you can take, certification courses, specialized treatment approaches. It's just growing and evolving continuously. I'm Vital Stim certified, which is, it's not really that new, but it's kind of new. Basically, it's you put electrodes on the person's throat, and it helps them learn how to swallow again. There's myofascial release for muscles. You can just go on, and there's so much advancement, and you can just go to school constantly and learn more and more. It's definitely a growing field, and you can specialize in very specific things that other people don't have the certifications in. Did I answer your question? Okay.
One more in the back.
Hi. Wow. All right. To you, I was wondering if you have any other advice for pre-med students?
Well, as I said before, you know, it is hard to get into medical school. You know, you have to do well on your MCATs, and you need to have a good GPA on your science. You know, you need to be a well-rounded person also, and when you get interviewed, like when we do admissions, I'm on the actual admissions committee, and our assistant dean and admissions director is here today with us, and he probably could give you some really good tips. You know, but I really feel like when we interview, I'm looking for somebody who, you know, they may be on paper having great grades, and they may be on paper having good scores, but I want to see that their desires are there, and what they're, you know, how they come across with, if they're really interested in the profession and what they want to do with their life. And so I think those are the kinds of things that, you know, I would recommend. What year are you in?
Junior.
Okay, so you're ready to take your MCATs
Actually, I was going to take them following
next year?
I decided to take extra classes in the past to be more well-rounded and try to figure out what I want to do. But I want to take a break semester to try to get more hours into practice.
Well, for those of you who might be interested in investigating our profession, we're actually having like a pre-health professions day next Saturday at our school, and actually the College of Public Health and our school, Podiatric Medicine and Dentistry and Pharmacy from Temple, are going to be there to represent. We also offer, for those people who might be interested to see what we're all about, we have a summer and a winter internship, January 6th to 9th and June 7th to 14th, where we actually have you stay for a week and get to shadow a hospital and see what goes on in our profession. So if anybody wants to really investigate our profession, Mr. Martin is sitting here. He'd be more than happy after we were done to give you some information, brochures, etc. I hope that answered your question.
I would like to add something to that. A follow-up on something that I said earlier is if you apply to any graduate program and you are granted an interview, you are as good as everybody else there So people are just checking to see if they would like to have you work with them, okay? I have a very busy life, and I don't want a problematic person in my program. So this is why I said personal connection can make the difference. And hint, hint, the people here that make decision, you should, approach them and make a personal connection. And when your name is among 100 others, they might remember who you are. And that is true for any graduate program you are applying.
Awesome. You had one more thing?
I was going to add one more thing. I didn't apply to med school, but for all those who are just applying in general, you got to think that the minimum requirement is you did everything that everyone else did. So you got to find something in your resume that makes you stick out. Is it that you work as an emergency room technician? Is it that you were community service? Something that shows that you have passion for your field. Because I highly doubt if there's 20 spots, they just go from the top 20 GPAs and just bring them in. What in your resume makes you stick out? What shows that you have passion for this kind of field?
Awesome. And because a lot of the questions are geared towards applying to grad schools as well. This is a shameless plug. Next meeting for the Health Science Club, we're going to have a panel of students who have applied to grad programs. If you have different professions you want us to have represented, come find me after. We're still working to organize it, but that'll be November 15th, 2 weeks from today. So, and thank you all to our panelists for coming and speaking, giving us their time. A round of applause. And thank you all for coming. You can join us for pizza around the side of the theater. Thank you.